Hi, welcome. My name is Alberto Cortez, CEO of Mama's Kitchen. I want to welcome you all to our second State of the Kitchen information gathering to give you an update of what's going on at Mama's Kitchen. The last time we did this was in April of 2020. Surprising how much time has gone by, how many things have changed, and how many things haven't changed. I want to welcome you all and thank you for making the time to join us this afternoon, to give you a status of what's going on. I also want to express my heartfelt appreciation for your thoughtful and loyal continued engagement and support of Mama's Kitchen, despite the many challenges that we face as a society, our public health challenges, and all the other changes that we're experiencing as a country. Consistent with some of those changes, I think our theme has been one of change, responsiveness, and resilience. And I am grateful that we continue to be able to serve the people that we serve. Our goal during this whole period of COVID-19 has been to maintain our home delivered meal service available to people, respond to the increased need for that service. We've had to pause our pantry service and transfer all of those clients and offer the option of home delivered meals to all those clients, and doing all of that in a safe environment where the work setting is as consistent with recommendations from the Department of Public Health of how to diminish to the extent possible the risk of transmission of COVID. It's been challenging and affirming at the same time. We have been able to stay responsive to the needs of our community, and we have served more people with our home delivered meal program than we have ever in the history of the organization. As we continue to observe the evolution of the COVID-19 pandemic and the increased rates of infection based on the testing data that the county publishes almost on a daily basis, it became clear to me that we had, in more recent weeks, had to pivot one more time and make a very challenging decision. And that was to exclude and pause our volunteer service, our volunteer activities inside our building. It was a difficult decision, but I am convinced the right decision in order to maintain the safest environment in the building and encourage the volunteers that would normally be volunteering in the building during or have volunteered during the pandemic to stay at home and to take care of themselves, because I feel that the risks now are higher than they've ever been since the start of this pandemic. So for the last week and a half, and for the first time in over 30 years of the history of this organization, the kitchen activities and the staging activities and all other work in the building has been done exclusively by staff. And I want to take this opportunity to acknowledge the extraordinary work that the staff has done in stepping up to the plate to fill in the very large shoes of our volunteers and keep the operation going. Other things have been calibrated to make that possible. Our executive chef, Jason Martin, has modified our menus and meals to make it more tenable to get meals prepared, packaged, and out the door to our clients with, in essence, what is less people in the building. During all of this, we continue to deliver food. The preponderance of food being delivered is done by volunteers, and I am immensely grateful for the volunteers that continue to help us do our no-contact deliveries to our clients. It is the last and most critical step of all the processes that we go to in order to express our mission. And so we continue to respond to the nutritional needs of our clients who are, as I've shared before, at really high risk of complications from COVID should they become infected. And so our services are as critical as ever. And I really want to thank you for your support in making that happen. When we set up our this call, this State of the Kitchen event, we received an extraordinary number of emails with questions, and I'm sure, and I want to invite all of you to ask any questions that you may have. There's a chat or a comment section that you're welcome to write any questions so that we can be as responsive and interactive to your concerns and your interests. I'm looking at my screen and I can't really tell how many people are signed up, so I'm going to let go of that. In the last year, 2020, we provided services to more people than we have ever in the history of the organization. We have a chart that I'd like to share with you that shows how many people we have served relative to prior years. You will note that in 2020, we provided services to 3 times more people than we did in any of the years between, any single one of the years between 2005 and 2018. And we're providing services to about 40% more people than we did in 2019. The color codes that you see on this chart divide up, are to distinguish the different types of conditions that we are, that are the primary diagnosis of the people that we serve. And as you can see, the largest number of people that we've been serving in the last 2 years are people with cancer. And one of the biggest increases we've seen between 2019 and 2020 is our services to people with diabetes. We've had a slight increase of people with HIV, which is the blue color on the left, and our and that's our regular clients. The 302 represents people with HIV who have been transferred into the program because of our closure of our pantry. That would not normally be in our program. And so that is another significant number between 2019 and 2020. And our congestive heart failure numbers have also increased. And it's also the first year in which we started providing services to people with chronic kidney disease. And by the end of the year, we had already served 80 folks under that service category. This is a pretty dramatic change, and it is one that we have intended to be prepared for, albeit not at such a quick pace. But I am grateful to our leadership team, our staff, our board of directors, our supporters, our volunteers. Because of all of those components, we have been able to do this dramatic change and be responsive to this increased demand in our community. It affirms our preparedness and also gives us insight on how we can further grow and provide services to more people in our community. It's a great opportunity for us to look at our systems and figure out how we calibrate our systems to respond to greater need. I've shared in the past that I envision that as an organization, from a need perspective, we have the capacity of serving many more people. And to that end, we continue to plan for growth. We continue to figure out ways of increasing and improving our capacity. We look at all our systems, our staffing capacity, our building capacity, our technical upgrades that are needed, both in equipment, software, and hardware, to continue to have the organization prepared and primed and ready to respond to increased need. That is part of what has allowed us to do what we've done in 2020. And we continue to plan for more growth. And some of the areas that we're focusing on include technology. We are currently putting in some efforts into our software system. Our client software system is aged and probably one of our weakest links. And we are in active search mode in identifying an improved system that can get us well into the next decade. And I am excited about that. We anticipate that change to be happening within the next 6 months or so. We are, as always, looking at our kitchen equipment and figuring out ways of upgrading that. We, earlier in the year, in 2020, were also able to add more refrigeration space in our loading dock. And we anticipate using the building in more of a capacity to increase the space for the operations, the kitchen and staging component. I want to take an opportunity to speak a little bit about our pantry. We paused that service at the very start of the pandemic based on the risk of having people coming in to a facility where there were other people And in the passage of that time, we've decided that we are starting to plan on how we will be reopening the pantry, and anticipate that we will be reopening in a site not here in the kitchen, but in some other location where we can improve accessibility to public service, increase the size of the facility. And we're also taking this opportunity to revisit that service and figuring out ways of making it a more an improved service, how we can make it better, how we can align it more with our movement into medically tailored services, where any provision that we're making in our community isn't just the provision of food, but the provision of food that is looking to improve the wellness of the community we serve. And so at this point, and I know that there's a number of people that have asked the question about the pantry and what is the future of the pantry, we are still committed to eventually starting that service up again somewhere in the future. When that happens is going to be determined on how this pandemic progresses. It'll need to be at a time when we probably have greater vaccination in the broader community. We have more control over the percentage of infections, COVID infections that are being seen, and that the science around transmission is even more clear, where we can comfortably say we can start the service and provide it in a safe environment. I apologize for being vague on a timeline on that. My psychic skills are not that good. They never have been, but I can say with confidence that we are committed to bringing the pantry service back as part of one of our critical services here at Mama's Kitchen. I also want to speak to how we're doing the home delivered meal, and the fact that volunteers are still conducting that, and that's being conducted in what we're calling a no contact manner, in order to protect our clients when we're taking deliveries. The procedure basically that is in place is that our volunteers, in some cases, call ahead or knock on the door, put down the food, step back 6 feet, wait for the client to come out and pick up the food and take it inside. We are not, and never have, left food at the door. There's a public health ordinance that prohibits that, not to mention that it's a food hazard, because if we're not assured that that client is taking that food in, we don't know how long that food will sit out, and there are perishable items in the deliveries that we have. So we still thus make sure that the food is delivered without contact, but that food is also taken into the home before the driver leaves. Volunteer activities. Given that we are currently not having volunteers in the building, the primary form of volunteering at this time is as a driver. And we are always in need of drivers. We currently have about 56 routes, and we continue to deliver on Tuesdays and Fridays. And if you are looking to be involved in the organization as a volunteer, driving, if you can, is one way of doing that. There is a component to driving that is not essential as a kitchen worker or a staging worker, and that's that volunteer drivers need to have a background check. So just that you know, and it's a policy that we have that is triggered by our government contract requirements, because and the rationale is that you are having contact with clients of the organization. So if you are looking to be involved at this time, driving is absolutely one of the options that is still available and still encouraged. I want to invite you to come to our next volunteer orientation if you've not already been to it, and that's on February 3rd. And I think I got that date right. February 3rd at I'm gonna ask Mark if you can give specific information on our next volunteer orientation, please.
Hi, everyone. Yes, our next virtual orientation, all of our orientations are now being held virtually.
Cool.
Thursday, February 4th at 4 o'clock in the afternoon. All of those call-in details, application information is at mamaskitchen.org/volunteer. We would love to have you.
Thank you. Thank you, Mark. I appreciate it. Other ways in which you can support the organization is from a fundraising perspective. This year, our budget, in great part because of COVID, increased by over a third, about 34%, and from close to $3 million to $4 million a year. So our fundraising efforts are as critical as ever. And obviously fundraising events are not the most popular event, and I'm sure that none of you are eager to attend another Zoom activity. But we want to encourage you to consider ways in which maybe you can help the organization if your comfort and time allows it, where you can host a fundraising page, figure out ways in which your work environment can support the organization, and certainly be advocates for our work in your circle of support, because community support continues to be as critical as ever. I want to invite our Jenna Novotny, our Director of Development, to share with you some of our ideas around fundraising opportunities. Jenna.
Thanks, Alberto. It's a pleasure to be with everyone. Looking forward to seeing faces again once we can all gather here at the kitchen. As Alberto mentioned, with seeing such an increase in our budget this year, ways that individuals can support are incredibly crucial. And as he mentioned, that there are some ways where, sometimes it may not be that you individually have the capacity to give at this time, but, spreading the word throughout your network. On mamaskitchen.org, under donate, we have an option to host your own virtual fundraiser. Through that method, you can actually even pick how many meals you would like to help fund. Our team can help with that. And then you set a goal and you can actually share that within your network, with your friends, family, social media, to help us, reach certain goals and to help us continue our services. Other things that we have available is actually our monthly Bread and Butter Club. This program is really important to Mama's Kitchen because it helps with the long-term sustainability of our individual giving, by committing, even the cost of a cup of coffee each month. You're able to allow Mama's Kitchen to have that sustainable knowledge for projections for our future throughout the year. And of course, like Alberto said, advocating throughout your network. A lot of times companies do offer employee matching or employee-driven grants. Sometimes it just takes even asking your human resources or accounting director if your company does anything like that. And there are lots of local corporations, big and small, that do that. along with corporate volunteer opportunities. While, of course, we don't have our corporate volunteer opportunities at the kitchen right now, in regular circumstances, we host those throughout the year. And so while we may not be able to start those up with your company now, we would love to have those conversations so that we could invite you and your fellow coworkers, employees to join us down the road. So please don't hesitate to reach out. I'll add my email address in the comments, and would love to have any type of conversations, answer any questions about that.
And Jenna, since I have you on, and can you share any questions that have been coming in during the course of the presentation?
Yes, one question that I'll actually go ahead and answer. We had received a question asking if we've received any additional government support, seeing that the service that we're providing is so crucial during this time. And I can answer that we have stayed on top of applying for any of the CARES Act PPP loans, all of the additional funding opportunities that have been put out that we qualify for. Of course, those are not long-term funding opportunities. So we, stay on top of applying for those when they become available, but want to make sure that we are able to fund and sustain this growth and increased demand for a longer period of time, even if that government funding is not available. So some other questions, excellent questions that have come up, and especially for some of our new supporters or new volunteers, Alberto, could you explain how clients come on to our home delivered meal program? How are they referred in?
Thank you for the question. Our clients come through our program by a third-party referral process. In other words, we have relationships and collaborations with local healthcare organizations, social service organizations that are providing services to the populations that we serve, and they make the referrals of their clients into our program. We receive those referrals, we process them in a very timely manner, and look to integrate those folks as quickly as possible into our service. So we have connection, among others, with places like Kaiser, community health centers like Vista Community Clinics, Family Health Centers of San Diego, San Isidro Health Center, just to name a few. But really, we have collaborations with literally dozens and dozens of organizations that are the sources of referral into our home delivered meal program.
Perfect. And we do require that, of course, to ensure that we're serving those who are most at need, and that the individuals we serve verify their critical illness and that they are unable to prepare food for themselves due to mental or physical disability. But we also we maintain those important relationships because they are a crucial touch point throughout the community. They're the ones that are witnessing the important need throughout the community. And so they're the ones that can advocate on behalf of their patients in order to connect them to Mama's Kitchen.
And they refer to us with the understanding that we're providing an intervention that is really looking to be one more component to help their long-term well-being and prognosis by providing an intervention that is medically tailored to their specific situation.
And another great question we have is there any way that Mama's Kitchen staff or volunteers will have access to vaccines in the future?
That's a really wonderful question, and I really wish I had a really concrete answer for that. We are currently trying to figure out a way of getting into the queue in the higher tiers as a health provider. We're looking, the first step in that process is to have somebody get an appointment and then us being able to issue a letter. At this point, we're limiting that process. We will be limiting that process to employees, and but my hope is that as soon as we can get our foot in the door on that, that we may also be able to provide it for volunteers that are working in the kitchen, in the staging area, and delivering meals. The challenge right now, or the biggest obstacle, is simply getting an appointment to get a vaccine. And the second obstacle is that they don't turn you away because the documentation that you have may not be convincing enough for them to think that you're in that tier of service.
Great. And as far as the sustainability of staff being able to, serve all the roles in the kitchen and staging, can you speak about if you envision a need for additional hiring and how you see that being sustainable?
First of all, it is the current model that we're implementing is under more of an emergency need, certainly not on an ongoing basis. I am keenly aware that it is not a sustainable model. Every staff person here has a purpose that is critical to the operation in some department, and every department in this organization is critical for the expression of the mission. So my goal is to go back to having our valued and essential volunteers back within the building as soon as it's safe and viable for us to make that happen. And I am committed to return us to that form of operation, because that is the spirit of who we are, that is the history of who we are, and that is what makes it possible for us to function and be viable over time. So we haven't hired new staff. We have, in some cases, increased the hours of part-time staff that have already been on. And so I don't anticipate at this point hiring folks to come in and help, given where we are. That could change. But at this time, that is not what we envision doing.
Perfect. And we had one question, additional question about the pantry and the move for what were current pantry clients to be able to now receive home delivered meals. Can you speak to, did those individuals have to certify their income, and perhaps also explain the difference between qualifications for our pantry versus home delivered meals when it comes to income?
Yeah, I don't want to misrepresent that. I do know that part of what makes it possible for us to allow our pantry clients to transition into our home delivered meal program is some funding from the county, some emergency funding from the county that is covering that expense. And the criteria is not the same, certainly from a physical and mental inability to prepare food, which is one of the fundamental criteria in our regular home delivered meal program. On the other hand, we have considered folks that are not necessarily that have been with us in the past. And so I don't know if anybody else is on the call that could answer that, and I can just come back with more specific details in the differentiation of the pantry clients getting home delivered meals and our regular clients getting home delivered meal. We can follow up with a more detailed description of the differentiators.
Perfect. And I actually, not a question as much as a comment, Denise wanted to thank us for providing a microwave. She is one of our volunteer drivers, and one of her clients was in need of a microwave in order to heat up our meals are provided blast chilled. And so this was also an opportunity that we can explain, Alberto, other than the home delivered meals, what other types of accessories we provide so that our clients can, get the best nutritional value from them.
Absolutely. We look to, we do an intake with our clients when they first come into our program so that we can have as complete a picture as possible of what their living situation is, what their capacity is, and how, to the extent possible, we can tailor the service to meet their needs or their challenges. Among other things, we do provide a microwave to our clients if they have no way of heating food, because we send out all our food cold, and they're pre-packaged in-kitchen prepared meals, but they're all frozen or cold. And so it's essential for them to have a way of heating that food. And if they don't, we will provide a microwave. In addition, there are some folks that have challenges with hard food. And we also provide food choppers that can help folks be able to chop their food and be able to consume it. We will also, in line with that, look to tailor the diet to not only what is medically important for them, but what might otherwise be some of their nutritional expectations, including whether they're vegetarian or they have some other dislikes of some items or some food allergies. We take all of those aspects into consideration to make sure that we are able to meet that person's needs. In addition to providing microwaves and other items and tailoring the home delivered meal program, we also, and I spoke a little bit about the Pantry service, which will be returning at some point, we also have what is called an emergency food assistance program, which is funded by the county, and it's focused on folks who have folks with HIV, because it's funded under Ryan White, which is HIV-specific funding, where we can provide up to 12 bags of emergency food if they're referred to us by one of the agencies. It's normally a social service agency or one of the community clinics. In addition to that, one of the valuable components of what we provide is nutrition education, nutrition counseling, and medical nutrition therapy that all fall within the work of our two incredibly talented and expert registered dietitians who spend hundreds of hours on the phone with our clients looking to do intakes, to provide nutrition education, and to give information on how what their needs are so that we can be responsive and to educate them. Oftentimes our clients need even sometimes very fundamental knowledge on nutrition. We are oftentimes providing meals that are unfamiliar to our clients because they have historically many live in food deserts where access to food is limited to, McDonald's and Burger King and Wendy's, and they're generally diets that are thin on fibers and fruit and vegetables, and are less balanced. And so, many of our clients may also have never had salmon over quinoa. And so we do educate them on what we're providing and the purpose of the food and the value of the nutrition. Did that answer the question?
Yes.
Okay.
That was wonderful.
We're doing Untitled.
New supporters who, this is their first time learning more in-depth information about our programs. That really wraps up most of the questions that we've had come in. I'll give it another minute if anyone wants to ask a final question. I think, one other thought, Alberto, in April, we as an organization did a delivery of a week's worth of shelf-stable food in the event that the situation prevented us from being able to do so. Is that something that you foresee being done again in the future?
Yes. So at that time, we provided, as Jenna said, a week's worth of shelf-stable food to all of our clients without interrupting the services that we were providing at the time. Currently, our leadership team is working on setting up a delivery as a backup for a worst-case scenario where we are able to provide shelf-stable food at the off chance that, because it's just staff working in the kitchen and in operations, at the off chance that we have a COVID outbreak that would not allow us to continue to provide food for a period of a week or 2 weeks, that we have food available, shelf-stable food available, that we can continue to send to our clients during that worst-case scenario. So I thank you for that reminder, because I just want you to understand that we continue to figure out how we're going to deal with scenarios that we have not yet and hopefully will never have to experience, but are still responsible to be prepared for. And so we are certainly looking at that. And so that even in a worst case scenario, there is no pause in the service that we provide. I want to also touch on one other thing that we've lived in times of challenges, and there is a light in the end of the tunnel, and there have been some changes that many of us would agree are positive changes, but still we live lots of challenges, and yet as a community, we do continue to function from places of generosity and kindness, and thinking of our fellow neighbors and those that are more vulnerable to hunger and malnutrition and the homeless, etc. And so I do want to take a time for us to pause and express gratitude for the many wonderful unsung things that happen in our broader community. I think for me, one of the things that speaks to our contribution to that in our community is our impact on over 30 years of existence. And we're coming up to a milestone that also affirms that. Sometime in the next 5-6 months or so, we will be hitting our 10 millionth delivery since the inception of this organization. And I see that as an opportunity of bragging about the amazing community that over decades has stepped up to be responsive to the needs of others, to think selflessly for others, and that it translates to the impact of thousands and thousands of lives over many years that have been made better, where the message has been way more than just about nutrition. They are statements of love and care and consideration in a world where sometimes we may think there is a lack of it. So I'm thrilled that we will be in the next months or so be able to come to that milestone and celebrate and acknowledge that as and acknowledge it, our community, for making this happen.
Definitely sooner than we had anticipated, but we will celebrate it nonetheless. We did have one last question come in, and it'll be our final question. We have someone curious to know if we see any parallels between the current situation that we're going through and the AIDS crisis.
Wow. There are many parallels, and I can certainly speak from firsthand experience because I'm old enough. I moved to San Diego in 1983 and started volunteering around HIV, which was almost exclusively at the time impacting my LGBT community. And when I moved here in '83, there were 22 cases of AIDS in San Diego County. And watched over the years how that epidemic, eventual pandemic, affected our community, and affected our community in a horrible way, and also affected the response to that pandemic in such an amazing and positive way of creating awareness and creating hope and support and love to folks that were otherwise isolated. So as we live these months of this pandemic, which have been so challenging, it provides us an opportunity to not just compare, but to yet again be reminded that we take nothing for granted, and that as our lives become more challenging, so too becomes our responsibility to help make our community better. And so therein lies the dichotomy of asking for more when we are experiencing greater challenges. I hope that as the arc of infections start diminishing, and we can start looking at COVID as something coming to an end or something of the past, that we can look back and feel a sense of gratitude for the work that the community has done to care for and convey a message of hope and of truth, and that we are able to sit in peace with that, that we were on the right side of history in addressing this pandemic, not unlike how organizations like Mama's Kitchen came to be in the throes of the AIDS pandemic, in response to a need rather than in judgment of it. So I can hope you feel assured that you are on the right side, and that you feel hopeful that we will get through this, and that we will be stronger, and that we will be resilient and affirmed in the fact that we are doing what is right, and that we are making our community a better place.
Thank you, Alberto. Well, as we wrap up, I will just address one last question that popped up about, of course, Mama's Day, our fundraising event that typically happens in May, the Friday before Mother's Day. While we as well agree that we will not be able to celebrate Mama's Day together as we typically do, our team is thinking and planning other ways that we will be able to engage with the community as a fundraising opportunity and a way to support Mama's Kitchen. So, more to come on that. we will definitely look forward to sharing those opportunities once those come to fruition. So thank you everyone for joining us today. You'll see below that if you do have any questions or comments regarding volunteer opportunities, please feel free to email Mark. And for any other questions pertaining to donation support or just any other general questions, feel free to email myself, Jenna. Our email addresses are there. Thank you, Alberto, for sharing all the wonderful insight. And thank you to all of our supporters, all of our volunteers. None of this would be possible without your dedication. Thank you for helping us be able to continue the incredible goal of still, and now in 30 years, Alberto, we've never turned away or waitlisted an eligible client, even throughout this COVID crisis. So thank you so much for making that possible.
Thank you, everyone, for your presence and your participation. It is, you are what make our mission possible. So thank you.
Thank you, everybody. See you soon.
Bye, guys.